I'm Dr. Ravi Varma. I'm an interventional neuroradiologist at Citi Neuro Center, Hyderabad. My role at Citi Neuro Center is twofold. One, I'm a diagnostic neuroradiologist in which I use technologies such as CT and MRI to offer diagnosis to the patient, as in I diagnose what exactly the patient's problem is, and then based on this diagnosis, my colleague neurologists and neurosurgeons treat the patient effectively. My second role, and probably the more exciting role in Citi Neuro Center, is that I'm an interventional neuroradiologist. By interventional neuroradiology, we mean it's a field in which we offer treatments that for difficult to treat conditions using simple technique. For example, we have X-rays that have been there for many years now, and we use this X-ray technology to opacify blood vessels, to diagnose where the blood vessels are, to track where the blood vessels are, and we can introduce different materials into these blood vessels, and we can treat diseases using these techniques. These techniques are also called as endovascular techniques, and predominantly they are used for abnormalities of the blood vessels in the brain, spine and head and neck. For example, if you have a patient who has got a stroke is either because of stoppage of blood supply to a part of the brain or because of rupture or bursting of one of the blood vessels of the brain. So we use interventional neuroradiological techniques to identify where this abnormality is and also to treat it. For example, we use this material, this is called as a catheter. This is a thin tube that's about 1 meter long and 1 millimeter in wide. What we do is we make a small 2 millimeter incision, a small needle puncture on the patient's groin area, and through that we insert this tube and take it all the way into the blood vessels of the neck so that we can identify where exactly the problem is. And based on that, we can treat the conditions also. For example, if you've got a patient who has a blockage of the blood vessel, we can mechanically remove the blood clot so that the blood supply to the brain is established again and the patient can recover from a major stroke without its after effects. On the other hand, if you have a rupture of the blood vessel, if there is a blood vessel that is weak and it is ruptured, something called as an aneurysm, what we do is we go all the way using these small thin catheters called as microcatheters. You can see that it is hardly 1/3 of a millimeter in diameter. We take it through these large catheters all the way into the brain. We can reach up to the small arteries of the brain, and using our guidance of our advanced cath lab over here, where we can depict all the small blood vessels of the brain with exquisite details, we can technically go into those small blood vessels, identify where the problem is. For example, there is a patient with an aneurysm over here. There is a bulge on the artery, and this represents a weak spot which can burst at any point of time. So what we do is to use these microcatheters, go into this area, selectively put it inside this and fill this aneurysm with platinum coils so that the aneurysm is blocked, the arteries are normal and the patient can live a normal life. This technology, interventional neuroradiology, has come up over the past 2 decades, and over the past 10 years we've had some wonderful experiences with this, and patients who previously required major surgeries, complex neurosurgeries, we are able to treat within a few days and without a requirement for a major surgery. With minimal risks, we are able to give maximal results.